So, welcome everybody to our second Zeldis Buzz podcast. I'm joined today by my colleague Leanne Benvignati, who is our head of our healthcare division, health insurance division at Zeldis Research. She's our practice lead there. And Leanne and her team worked to put together, kind of look at the work we've been doing in the health insurance space over the last year to see kind of what we see as the trends and the hot topics in that industry when it comes to research and what's important to learn about from those relevant populations. So they put together some trends. There's going to be kind of a one-pager that goes along with this that outlines those. And so Leanne and I are just going to kind of talk about those a little bit. I'm going to ask her what her and her team came up with. So I'm going to start out, Leanne, the first trend that you all pulled out was around kind of an increased or higher level of focus on government programs in health insurance like Medicare and Medicaid. So tell us a little bit about that.
Sure. Yeah, absolutely. Great. And thanks for doing this. This was fun. We had a lot of fun getting together as a team and brainstorming on this. So great opportunity. We appreciate it. But yeah, so immediately when we started thinking about trends, government programs came to mind. Of course, for years we've been doing research with government programs, Medicaid and Medicare and dual, but we've really seen an uptick in recent years with all different kinds of studies that we've been doing. And, when I was doing a little bit of research thinking about this, I learned that 1 in 3 Americans has a Medicare, Medicaid, or dual plan. And so just even given that statistic, it's not surprising that insurers are focusing their research dollars in this area just by the sheer number of people that have this type of plan. And really, we're doing so many different methodologies with these individuals. And I was thinking about even just, when we talk to these members, they're bombarded with information from the different carriers and just the competitiveness. I mean, if you've ever watched daytime TV, all the commercials, it's all related to Medicare or dual plans. And so really, there are just so many different studies, and we do online with these members. We still do phone because oftentimes there aren't emails available, and it's really successful. And we've been doing communities with these types of members, and really just trying to understand their shopping experiences, the decision-making process, what they go through, who's impacting that, why they switch plans. All of this is critically important, and we've been, getting at this in just so many different ways for our clients.
That's awesome. I mean, you and I worked on and are continuing to work on a study where we're doing both in-person and webcam focus groups with DSNP, with dual eligibles. And both of those can be successful, right? We've made both of those works depending on location and where we're trying to target. So yeah, definitely making up a big chunk of the health insurance work we're doing. And we're seeing even some clients move out of sort of the commercial markets or and more into the government programs. So
absolutely. And we also have to think about incentivizing these members, and that just gets more and more difficult because of CMS regulations. And so, we've had to, I know you've had experience with this too, that you really just have to kind of get creative to figure out how we can do it. And sometimes we can't get creative, and we're limited with what we can offer, and then it just becomes the charm of our recruiters.
Yeah, I mean, yes, the compliance requirements, both as a supplier in this space, but also in terms of executing the research, there's just so many different kind of rules and regulations we need to be following above and beyond what we would normally do in the market research industry. So it definitely makes it more complicated. I want to turn to kind of the next trend that you called out. And this was around kind of sort of healthcare for the entire person, or more holistic perspective when it comes to healthcare. So tell me a little bit more about that.
Sure, absolutely. So historically, when we were doing research in this market, it was really focused on the medical side of things and the health plan, and of course satisfaction with the health plan, but making sure that consumers can get their medical needs met, and really the focus was on their physical being. But we've seen in the past year or two, and I really think the pandemic has impacted this as well, that really it's come to light, particularly for health insurers, the importance of behavioral health. And so we've really been doing a lot in this space, research focused solely on behavioral health, but even in tracking studies that we've done, adding questions about access to providers and satisfaction with the quality of the provider. So it really has, kind of become more important, it seems, for insurers. And then also, I'm thinking about social determinants of health. That's also, something that I feel we're doing more of, and I think you
Yep.
might be experiencing that as well. So, just thinking about, where people live, their jobs, their community, their access to food and nutrition. And, insurers are really, starting to focus on the fact that this really has an impact on consumers' own health and wellness and well-being, and how, again, just that whole person, really looking at all of that when thinking about health outcomes, and not just focusing on the medical, as it
Absolutely.
seems to have been in the past.
Yeah. And I will say, because, I do a lot of work in the group benefit space, talking to employers. And I just want to call back when you're talking about behavioral health care. And in that space, when it comes to employers and what they're looking for in their partners, their carriers that they're working with to provide benefits to their employees, mental health has become, such a big focus there as well. Um, let's talk about the healthcare shopping experience. That's something else that you all called out, both in terms of kind of selecting a plan. We talked about the government programs and all those commercials and all those things that, my husband's turning 65 in the fall, and he's already starting to get inundated in emails and thinking about the shopping process, but also when it comes to actual healthcare delivery and provider selection and those kinds of things.
Absolutely, absolutely. And what we've been seeing is that consumers are really looking for an Amazon type shopping experience, if you will. And, and thinking about their healthcare, and, selecting a health plan, finding a provider, thinking about preparing for a procedure, really, all of that. They want information at their fingertips. They expect it to be at their fingertips. So digital tools come into play here, cost transparency, and, just knowing what to expect. No one wants surprises when it comes to getting bills and knowing what, you have to pay. So again, that can be for the health plan itself, but also, when you're accessing medical care, what is it going to cost? What are people going to pay, have to pay out of pocket? That's critically important. And so, thinking about digital tools, we do a lot of research around digital tools and member portals and mobile apps. And again, just making sure it's one thing to have these tools, but it's another thing for them to be user friendly and provide the information that they're really looking for. And again, just, transparency and cost, and just being able to find that information that they're looking for, and easily pay their bill, and all of
Absolutely.
that.
I mean, that's been a huge shift in the industry in the last 5 to 10 years, that consumer driven kind of approach.
Well, and I'll say, on, just thinking even further on that, for health insurers, being able to self-serve, if the members can self-serve and not call the health insurance
Sure.
company, members don't want to, many members don't want to have to call. There are some who do like that one-on-one. I think that'll always be the case, but many don't want to, have to call and, complain about wait times. So just, being able to self-serve benefits both can benefit both the member and the health insurer in terms of staffing and all that.
Costs. Yeah, for sure.
Mhm.
So the last thing that I want to talk about that you pulled out and the team talked about was around kind of the impact of COVID, right? We're living in the post-pandemic world, and how has that affected the health insurance and the healthcare environment, and how has it affected really even how we do research?
Right, exactly. And so, what we've been seeing is and talking about is just the fact that, well, first that, some folks didn't get preventive care during COVID. They weren't seeing their doctors, going to their doctors. And so now that I'll say the world kind of has opened back up again, there's been a fallout from that. You know, people are now trying to get that preventative care that they weren't getting, but also they might be seeing some health impacts of not getting care. So, doctors' offices are, perhaps being inundated with patients that are trying to get care. And then on the flip side, we've seen so people leaving field, due to the pandemic and since that, and there's a shortage of nurses, and you hear about that in the news. So here you have, offices that are short-staffed and more patients trying to get in. And so, it makes it difficult. And so bringing that back to our research, we research and hear about this in doing our research, but it also can make our research difficult when we're trying to, outreach to provider offices and get feedback in provider satisfaction surveys and appointment availability surveys that we do. And it's very difficult to get through because, they're understaffed and the folks that are there are overworked. And so trying to get them to complete a survey isn't necessarily high on their priority list. So we've had to, studies might take a little longer than we're used to. We have to allow for more field time, really just to make sure that we can get what we need done for the projects.
Sure. And I'm guessing that impacts qualitative too, right? They're not going to want to spend time on an hour-long call if they're barely
Right.
by because they have so many patients that they're trying to see and get through. Uh,
Absolutely.
yeah, for sure. Well, I appreciate you taking the time to chat with me today. It was really interesting to hear about some of these trends that we've seen and that we're experiencing and what we do. Um, for those in our audience, we will be running a series kind of in trends in the different industries that we work in. So keep an eye out for those. Hopefully, this will be of interest for those of you who are in the health and health insurance space. So thank you very much, Leanne. I appreciate it.
Oh, my pleasure. All right. Thank you. Take
Thanks.
care.